Mr Hancock believes new treatments and vaccines will turn COVID-19 into a disease we can live with like we do flu. The health secretary said new drugs should arrive in 2021 that will make coronavirus much more treatable. Speaking to the Daily Telegraph, he said vaccines would reduce the number of people admitted to hospital, bring down the number of deaths and cut transmission of the virus. I hope that COVID-19 will become a treatable disease by the end of the year, he said. If COVID-19 ends up being like flu, so we live our normal lives and we mitigate through vaccines and treatments, then we can get on with everything again. Mr Hancock's remarks will spark speculation that the government is not pursuing an elimination strategy aimed at ruling out COVID-19 in Britain. More than 14 million people in the UK have now been given their first vaccine dose, and on Friday the R number dropped below 1 for the first time since July. According to official data, the number is now between 0.7 and 0.9 in every region of the UK. Mr Hancock also said that he hoped every adult in the UK would be offered a vaccine before September. Monday is the deadline for the government to meet its pledge of offering a vaccine to all over 70s, care home residents, health workers and those who are told to shield. The target could be met as soon as today. Around 30 ministers, including Home Secretary Priti Patel and Vaccines Minister Nadhim Zahawi, will this weekend make public appearances in a drive to reassure communities who have been more reluctant to be vaccinated. An uptake plan is also being published which suggests ways to maximize the rollout, including the use of vaccine buses. Former Cabinet Minister Damian Green told the BBC's Newsnight a so-called zero-COVID strategy, aimed at eliminating the virus entirely from the UK, is probably a mirage. He added, "It is going to be with us, we are going to have to live with it." But Mr Green said by vaccinating a large part of the population, particularly those most at risk, and approving new treatments, we can slowly, gradually, cautiously open up with the confidence that we are not going to have to lock down again. Conservative MP David Davis told BBC Radio 4 today, "There will come a point where there will be a death rate from COVID, but it's at a normal level and then we have to cope with it." Obviously we try to prevent it, but we accept it, I think, we have to. However, Dr. Sarah Pitt, a virologist at the University of Brighton, disagreed with Mr Hancock's suggestion that we could live with coronavirus like we do the flu. She told BBC Radio 5 Live, "It's not a type of flu. It's not the same sort of virus. It doesn't cause the same sort of disease, it's very, very nasty. The mutations, the variations, that we're seeing are becoming more infectious, not less infectious, and a bit more dangerous, not less dangerous." Altmann, professor of immunology at Imperial College London, said he agreed with the health secretary's comments about the UK potentially living with coronavirus in the future in the same way as the flu. Professor Altmann told Times Radio, "I agree with the by the end of the year part. I think the jury's out on what the future will look like." On
news of the number of coronavirus patients in hospitals going down, he said, "We're all following the data in the UK and from Israel, who are a little bit ahead of the curve in terms of vaccinations, and seeing those transmission graphs absolutely being quashed." We can't easily pick apart how much of that is lockdown, how much is vaccination, but it's certainly both of those things. I am cautiously optimistic that we are winning finally. Next week, GPs will start offering jabs to millions of young and middle-aged adults with health conditions such as diabetes and heart disease. The rollout to the next group on the priority list, those aged 65 to 69, is already underway in areas which have hit the first target. The bulk of those aged 65 to 69 should receive first doses in the next fortnight, with those aged 60 to 64 next on the list, and everyone over the age of 50 promised their first jab by the end of April. Latest figures show that more than 9 in 10 of all over 70s have had their first dose. In the past 10 days, COVID deaths have almost halved among the over 85s, falling at twice the rates seen in younger unvaccinated groups. Among those aged 85 and over, COVID deaths fell by 41% between January 28 and February 7, compared with a 22% reduction among those below the age of 65. More about coronavirus. Mad Hancock vaccines. Comments reuse content.